in related to motherhood and pregnancy lactation, and I will be taking it live. And definitely, you are going to be benefited of these questions. So to begin with, let's start with our first question for the day. Uh, so basically, what we do is that we take up these live sessions and we understand that these questions are from the users, and you are worried, you want to understand how to deal with your pregnancy, how to deal with your lactation problems, and I am here as a community expert, and I will be helping you out to answer them. First question for the day is: my baby is 5 months old and he is not started drooling. So now I would like to answer this mom that this mom looks at distress and is not understanding whether the development of the child is happening in the correct way or not. So I would like to tell her that all the babies take their own time to have their own milestones, and definitely it is very good to watch and understand that each time the baby is trying to develop a new habit or a new milestone, it will be in phases. They will take their own sweet time. Probably what I would suggest is that the baby can be given a good massage for strengthening the legs and hand muscles, and also that a little assistance to the baby if the baby is making an effort. We need to also understand that the baby should be kept on the tummy at least once during the day, which will make them have a little strong back and leg muscles, neck muscles. So this will help the baby to start rolling over, and definitely your child will be progressing in a much better way. The second question for the day, that is here, that hello, I am blessed with a baby boy. Congratulations. Now the question is it normal for the baby to bite on the nipples? I am having a good supply of milk, but still the baby is biting me with his very strong gums. And I tried using nipple shield, but it didn't work. Can you please suggest me a remedy on this? Yes, now over here, I would like to help the new mom. First of all, congratulations, you're doing a wonderful job. The baby is suckling well at the nipple, plus, you, as per your conversation, there is a good milk supply. Only care you have to understand is that you need to elevate the child's head a little bit for the latch to be proper. Probably that the gums of the child is very strong, so you might feel the hold to be a little tight. If you elevate the head and put a cushion or help support the child with a hand, the latch would be a little proper. At some point of time, the child may forcefully bite on the nipple, which may cause a difference in the latching position, and this may damage the nipples. It is not a good idea to use a nipple shield at this moment, but I would insist that you continue doing whatever you're doing, and you're doing a wonderful job. So, the next question for the day is it safe to give gripe water for a 2-month old baby? Okay, now this is a very good question because it is summers and supposedly the child has, gas problem or colic problem, or the child is passing a lot of um, pain in the on the stomach and is not able to pass motions. The doctors generally suggest to give gripe water, but as we all know that apart from the mother's milk, nothing else is suggested due to the guidelines given by the WHO. We also need to understand that when the babies are given gripe water, it is not really very safe because it is having more than 3% of alcohol, processed sugar, and lot of soda bicarbonate. This generally helps the baby to go to sleep and stop crying, which makes the baby also dizzy at a given point of time. Okay, so what an ideal method would be, maybe you can hold the baby in a sit up position and kind of help the baby to burp. Secondly, you can do a tummy massage. Thirdly, you will be able to do a little massage on the stomach in a circular motion. Do cycling for the child. Hold the child's leg and do a cycling for the child. Be very gentle because it is a 2-month old child and we don't want them to have any other troubles. So, lie after every 2 hours or so, Do a lot of light massages. This will help your baby to relax or pass the gases which have happened. Okay. Also ensure that when you're feeding the child, the latch is proper, the position while feeding is also very correct, and this will ensure your firm behavior of the child suckling at the breast. Okay, I hope this is helpful for you. The next question is, can we give a half drop of honey to a 2-month old baby? Does it cause any diseases? Now, for a new mom, we also have to understand that every time we introduce something new, it is going to cause a lot of distress on the child's stomach. This is because the child's digestive system is being developed, and we need to understand that any foreign substance is going to cause a harm to the child's stomach. So, honey like substances definitely cause a disease which is known as Clostridium, which is basically a gut infection because of which the child may end up in many loose motions. What I would suggest you over here is that likewise we can work towards avoiding such things, and ideally we should be suggesting or having what we call as uh, breast milk for the child. This will enhance our uh, work, and it will help the child to be fed properly. Our next question for the day is, my baby is 2 months old and he is not well, and he is not taking my feed. I am very, very sad. What should I do? So, this is a kind of anxiety which generally comes up with moms, new moms, and it is very, very genuine. I do understand your problem and your trouble. What I would suggest you that you start taking a start taking the baby on a dream feed, basically where you're imagining that you're feeding the baby. This is like an emotional support that you're trying to give to the baby, and definitely it is going to help you. Secondly, sideline position is something which you can try while you are feeding the child. Both these things will be definitely helpful for you. Give yourself a day or two and things will settle down probably. The next question that we have is, when can I have juices after C-section? So, for a mother who is just undergoing operation, you can have all kind of juices, but ideally we would encourage you to have a whole fruit which would give you a lot of fiber and help you to have a smooth gut system. If juices are taken, fiber is not present in it, and you might end up in constipation, because of which there would be pain in the stitches. The next question that I'm getting is, my baby is 1 month old. I'm getting pain while feeding, और कभी कभी पेन काफ़ी होता है, एंड आफ्टर फीडिंग काफ़ी देर तक पेन होता है. Now, for me to explain you this question, let us understand that you are a child is 1 month old. The child is still trying to understand the position and the latch of breastfeeding. ये ब्रेस्ट पेन और निपल पेन प्रेगनेंसी के दौरान बहुत ज़्यादा कॉमन होता है. हमको ये देखने का है कि हम हमारे ब्रेस्ट को जब हम फीडिंग नहीं कर रहे हैं तब मसाज करेंगे, कोल्ड वाटर से उसको धो सकते हैं या कैबेज लीव्स लगा सकते हैं. अगर वो पेन ज़्यादा रेडिएटिंग हो रहा है, वहाँ पे हम लोग निपल क्रीम लगा सकते हैं या कोकोनट ऑयल लगा सकते हैं. इससे हमारे निपल्स पे ज़्यादा फ़र्क पड़ेगा, और यही कारण है हमारे निपल्स जो हैं वो आसानी से पेन उनका रिड्यूस हो जाएगा. This will be very helpful, and definitely this is going to help you and comfort your baby at the same time. The next question that we are having for the day is that my baby is having a lot of rashes on the back. My baby is 6 months old and I am not able to understand what it could be due to. So, the mother who has asked me this question, I would like to tell you that these rashes could be due to the heat. Okay. And we use different kinds of oil, different kinds of soap, different kinds of powders to make our baby look beautiful and to enhance the skin and everything. But at this point of time, if your baby is having too many rashes, I would suggest that do not use any soap, any oil, or anything of this sort, and this will help your baby to go away from the rashes. Once the rashes go away, it will be very helpful for the child to be pacified, and the child would be happily giving you responses on the activities that you are doing. The next question is, hello everyone, my baby is 4 months old. He is doing good, but he is having very less and yellow color urine. I completely bottle feed him. What should I do? Now, for a baby of a 4 month old who is being bottle fed, and in this heat of summers, I do understand that the body starts getting into a state of dehydration. Okay, ideally, we are not supposed to give any kind of water to the baby, but over here, I would suggest that the baby should be equivalently breastfed in between so that the P count increases and the urine color goes from yellow to white. Secondly, the mother is in a little distress. I do understand her situation, but to get back to the same kind of a routine, I would urge the mother to increase the liquids in her diet, like buttermilk, ragi, you know, normal water, coconut water, sugarcane juice. These are the things which will help to intensify the fluid content of the mother in the body. The next question is that my baby boy has just completed 2 months and is not eating regularly and sleeping more and is sleeping more. Is that okay? Now, for a mother of a 2 year, for a mother of a 2 month old, this is a very genuine query where we have to understand that because of excess of sleep, the child's development will be taking place in a much better way. So we have to know that feeding after every 2.5 hours is very desirable. Also, we have to wake the child up, and we have to feed the child. So it's okay if the child sleeps for a longer period of time, but ensure that we feed them on time so that nourishment and that proper nutrition helps them to have a proper weight gain. I believe I have answered all your questions which were asked. To ask more further questions, you can reach out to me on the Baby Chakra app. You can also follow me on the same app, and also like the post, like the articles which I am writing in. I do a lot of live chats pertaining to parenthood, equal parenting, motherhood, fatherhood, because it is a platform where we speak about all about parents. So please do like and subscribe to the Baby Chakra app, and do let your friends know that I am Dr. Pooja Marathe, your community expert, being present on the Baby Chakra platform. Thank you for you being here. Please do keep watching our live chats, and we welcome you for the questions on board. Thank you so much.